What I'm doing now is just doing lidocaine with epinephrine to numb the sites where we're going to be doing the filler. We're going to be using Juvederm Ultra Plus in the lower face and Restylane Silk in the forehead. We're going to be using a micro cannula technique. We're also going to do a couple PDO threads for just a little bit of contour regularity right under an area of malar edema. Doing okay, Amy?
Mm-hmm.
And we do the lidocaine with epinephrine really at the sites where we're going to be using a micro cannula. We add the epinephrine because that causes a little bit of vasoconstriction, which makes it people less likely to bruise. Okay, stick. And how this works is we make a tiny hole in the skin with a needle, and then through that we put the micro cannula. And we thread this. We're just going to do a little bit of lip enhancement. Doing okay?
Mm-hmm.
I haven't really injected anything yet. I just want to get into the correct anatomic plane. Okay, now I'm there. My goal here is to be very superficial. This is a technique called submucosal shading, where we just put tiny bits of filler still not there yet. There we go. You really should be able to see and feel the tip of the micro cannula. Now I'm injecting a little bit of Juvederm just to kind of provide a little bit of subtle volume for the lower lip without really overdoing it. And again, a little safer technique with the micro cannula. Good. Doing okay?
Yes.
Now we're going to go to the cutaneous upper lip, because before when Amy was talking, we noticed there was a little bit of a ledge here. So I'm putting just tiny bits of filler here to just kind of smooth in the upper lip. Good. Okay, now I'm going to come back. So I've done that. I filled this region. Now I'm going to come back and I'm going to do that same submucosal sheeting technique for the upper lip. Okay, right here I'm in the vermilion border. Kind of see the tip of the micro cannula right there. And I'm just putting tiny little micro aliquots of filler in. Good. Same thing now, my goal is to be right here. You can kind of see the tip of my micro cannula. There we go. Nice. Just a little bit of, and what that does is it provides a little bit of volume. It kind of lifts the upper lip so we see more upper lip show, but without, overdoing. Now close. Okay. Great. And it didn't take that much volume to do that whole area. We did half a syringe, 0.5 milliliters of Juvederm Ultra Plus 50-50 blend. When we say 50-50 blend, what that refers to is we take one syringe of Juvederm Ultra Plus, which is 1 milliliter, and we take 1 milliliter of lidocaine without epinephrine, 1% lidocaine, and we mix the two together. So now that 1 milliliter is 2, and it's blended 50-50, so it makes it a little thinner. Almost like prehydrating a sponge. So people are going to be less likely to puff up after the treatment. Again, same thing I did on the other side. I want to treat a tiny bit of volume here, a little bit of volume here because of that dynamic upper cutaneous lip ledge that we noticed before we started treating. Okay, so I've done that. And now I'm going to come to the upper vermilion border. Again, using a micro cannula. Now you can even, I'm feeling the tip of my cannula. You can see it down there. And now I'm going to start injecting tiny bits of filler, antegrade. Antegrade injection using a micro cannula also serves as a means of hydrodissection where you kind of open the tissue in front of the tip of the cannula. Also makes it more comfortable for people. Well, I'm not quite there. Here's the tip of my cannula. I want to get here to the Cupid's bow. Now I'm there. Now I'm going to come back and I'm going to do that same submucosal shading technique for the upper lip. Again, you can see my cannula. Good. Now I'm coming down to the lower lip, kind of redirecting to the oral commissure. I'm using this finger as kind of counter traction to get the tip of my cannula moving in the direction that I want it to go. Now I'm at the lower vermilion border, there I am. And I'm going to do, same idea, a little bit of hydrodissection going right along vermilion border. You can see the tip of my cannula, submucosal sheeting. You can just kind of see the lip, filling out in those vertical lines, softening with this technique, and it takes a tiny bit of filler. This lower, I'm doing about 0.1 total, so it's not a lot of filler. And remember, this is 50-50 blend, so some of that is going to go on just when the lidocaine absorbs. Good. How was that?
That was fine.
Yeah. Okay. All right,
Not
good.
a problem.